My name's Kim Raine, and I'm a professor in the Center for Health Promotion Studies in the School of Public Health. My research is all about promoting healthy eating and healthy weights. So my background training is in nutrition. I'm a registered dietitian, but I was always more interested in understanding why people eat the way that they do, as opposed to what happens to the food after it gets into your body. So I'm particularly interested in understanding how social factors, cultural factors, that sort of thing influences why people choose the things that they do. But even more importantly, I'm a health promotion person, and health promotion is an action-oriented field, so I'm interested in interventions. What can we do to help promote healthy eating? So specifically, I work at both the community level, so I work with communities to figure out what are the barriers and the strengths in their communities that help to promote healthy eating, and then we work on strategies to improve those strengths to make the healthier choice the easier choice in those communities, and then we evaluate what worked about those interventions and under what context, and what were some of the factors that helped to make things work or not work. In addition to working on community-based interventions, I'm also very much interested in policy-based interventions. So a lot of the factors that influence our eating habits are grounded in policy. I mean, when I think about the lessons that we've learned from tobacco control over the last 40 years, things like restricting access to minors, putting limits on advertising, putting taxes on cigarettes so that they were more expensive, those are the types of factors that really influenced the impact of tobacco control. And so I've started trying to think about ways that we can take some of those lessons from tobacco and apply them to nutrition and also to physical activity. So we're looking at advocacy strategies to do things like restrict marketing of unhealthy foods and beverages to kids. So we do research first that looks at what is the impact of marketing of unhealthy food and beverages to kids and how much are kids exposed to, and then, okay, well, what can we do about putting some controls on that? One of the other examples would be putting taxes on sugar-sweetened beverages. So one of my students, for example, did a lot of research into how much sugar-sweetened beverages we're drinking, what are some of the factors that are influencing that, and if we put a tax on those beverages at a certain level, what would be the expected reduction in consumption, and also how much money would that bring in? Sort of revenue generation. We always think about interventions costing money, but interventions could actually save the health system money. And so those are the types of things I like to dabble in.